Shared decision-making is a very important part of the quality care that we provide for our patients. And in particular, it's important when there are a variety of decisions that could be made, but there's no clear one best choice for that patient. So in shared decision-making, we, the healthcare team, provide information for the options that they have, what is medically reasonable for that patient, and the patient brings information about what is most important to them and the practicalities of their life. When patients are faced with these different choices and no one choice is clearly best, and when we as the healthcare team can't say, this is the best choice for you, then that uncertainty leads to a difficult situation for them, a conflict internally, and we call this decisional conflict. The role of decision support is to help reduce this internal conflict, this decisional conflict, to help people come to the best decision for them. We, as the medical team, we provide the best medical and scientific evidence to give them an idea of outcomes, the pros and cons of each choice. But the patient themselves brings their belief system, what's important to them, their current reality, so that both those things come together at the table to make that decision the best one for that person. The decision support process has 5 steps. The first step involves providing information and education to the patient, and the information is often quite detailed and often comparative between the different choices available to that person. The second step involves the patients more directly in that they are asked to assess their own functional ability at that time, because we're looking for possible barriers to certain pathways and to start us working on how to overcome those barriers. The third step involves the patient clarifying what's most important to them, their values, especially as they pertain to the different choices. And the way it's laid out is such that as they make their choices about their own personal values, it becomes clearer, it's kind of highlighted which path might be the best one for them. Step 4 assesses the support that patient may need to carry out the decision that they're leaning toward. Things like what family is involved, what other decision makers are involved. Step 5 involves the patient and healthcare team member sitting down and figuring out what is missing. Does the person need more information? Do they need to go and talk with a family member, or are they pretty sure what they want and we need to start making planning for their actual renal replacement therapy? What we're using to do all this is the evidence-based Sherpa Decision Aid. So this is the decision support tool that provides us with the template to do all these steps. And the goal of it is for the healthcare team to help that individual patient plan for their future renal replacement therapy. In the video you're about to see, you'll see a patient and a healthcare team member share their insights about the use of this decision support tool. Different scenarios will show the difference between our traditional patient education methods and the use of this decision support approach.
Please have a seat. Hi, Francine.
Hi.
My name's Jackie, and I'm a nurse here at our kidney care clinic. How are you?
Not bad, thanks.
Good. So, I understand you're weighing in your modalities and your options, that you're trying to decide between in-center treatment and home therapy, maybe even peritoneal dialysis. Would you like to talk about it?
Yeah. My kidneys are getting a lot worse. Only 15% are functioning, and I know that I don't have a lot of time before I might need to make a decision about dialysis. Well, my doctor says probably a few months. Anyway, I've been to the information sessions, and I understand the difference between the different types of treatment. Just thinking about my dad. He had both types of dialysis. Anyway, I live with my daughter and her family, and I think that I'd like to do an in-home treatment, but at the same time, it just might be easier for my daughter if I went to a dialysis center. So I'm really undecided between the two options.
Okay, yeah, I understand. It's a lot of information to take in. So we've got a lot of brochures and booklets here that will help you make a decision concerning which type of dialysis you might want. So we're going to start here with the manual on in-center dialysis. Okay? This will break everything down, and that way that will make the decisional process a lot easier for you. Okay?
There's just too much to think about. I don't know what to do.
I understand it's a lot of information to take in. So please take all of these brochures and the pamphlets home with you, and you can have time to read them over.
You know, this is just really hard for me and my family.
Oh, I understand. That's why it's good to have a plan so that you don't feel rushed into making any decisions. Is there anything else you'd like us to go over?
No. No, thank you. I just need time to think.
Of course. In the meantime, if you've got any questions, please don't hesitate to call us. Here's our number. There you go. And you can also talk to your nephrologist at your next appointment.
Okay.
Okay?
Yeah.
All right. Thank you, Francine.
Okay.
Okay, we'll see you again.
Yeah.
Okay, bye.
My name is Randy Russell. I am a patient at the Ottawa Hospital, the Progressive Renal Insufficiency Clinic. I was diagnosed with polycystic kidneys 20-some years ago. Although the decrease in my kidney function has been gradual over 20-some years, you're always hoping that you'll slip through, and you'll make it through. But when she said that I had reached the 20% point and needed to be seen in a more comprehensive type clinic called the Progressive Renal Insufficiency Clinic, I was really downhearted. I was really sad because to me I thought, dialysis is just around the corner. The eyes all teared up, and I thought, oh no. And so very shortly after, just a few days as a matter of fact, I was invited to an information session to sort of demystify what PRI is all about, this scary PRI thing. And when I came through the first couple of orientation sessions, I thought this is wonderful, and it was clear from the outset that we would have an opportunity for a one-on-one following. But I came away from those sessions thinking, wow, that was a lot to take in, and frankly, I'm not sure that I can process that, and I had a thorough enough understanding to decide for a renal replacement therapy that I'll deal with for probably the rest of my living days. So I was still feeling very overwhelmed. Thankful for the information, but not near ready to make a decision as to what therapy I would choose.
Please come in. Hello, Francine. My name is Jackie, and I'm a nurse here in the Kidney Care Center. How are you today?
Not bad. Thank you.
Great. I understand you're weighing your modality options. You're trying to decide between an in-center treatment and home therapy, maybe peritoneal dialysis. Mm-hmm. Would you like to talk about it?
Yeah. My kidneys are getting a lot worse. Only 15% are functioning, and I know that I don't have a lot of time before I might need to make a decision about dialysis. Well, my doctor says just a few months. I've been to the information sessions, and I understand the difference between the different types of treatment, but I'm just thinking about my dad, He had both types of dialysis. I live with my daughter and her family, and I think that I would like to have an in-home treatment, but at the same time, it just might be easier for my daughter if I went to a dialysis center. So I'm really undecided between the two options.
I understand. It's a lot of information to take in, and it's perfectly normal to be overwhelmed. It's a difficult decision to make.
It is so hard for me and my family. I just need time to think.
Of course. Sometimes it helps to break the decision down into smaller parts. It'll help you make a plan so that you don't feel rushed into making any decisions. Okay? So what we have here is a tool called the Decision Aid, which helps break down the decision into smaller parts. For instance, do you have enough information about the options open to you? It helps you figure out what's important to you, what you want to avoid or accomplish in the process. And also, for the people who are near and dear to you, how are they going to weigh into the options as well?
That would be great. Thank you.
All right. Okay, so last week we went through something called the options grid, which went through the different renal replacement options available to you and often answers a lot of the questions that the patients might have. Do you remember?
Oh, yeah.
Yeah?
Yes.
Okay,
yes.
great. So now after last week and the information sessions you attended and the videos you watched, do you feel you have enough information and details in order for you to make the decision?
Yes, I do. Just not sure.
Okay, that's all right. So this next tool here will help us walk you through your daily activities, okay? It helps you figure out how you're feeling right now, what's important to you, and finally, what are the next steps, okay? So I'll just give you a pen here. There you go. Okay, so as far as your mobility goes, moving about, do you feel like you're moving about the same as usual, a little bit less than usual? Are you mostly sitting or are you mostly lying in bed?
I think I'm moving about the same as usual.
Okay, there we go. Okay, fantastic. Okay, so now we're moving on to... Great, so it looks like you're moving about rather independently and very well.
Yes. Well, I get a little tired, but I'm okay.
Okay. You'd mentioned going to the information sessions and watching the videos. Do you feel that you've gotten enough information from that?
I think so.
Okay. Do you know all the pros and cons?
Yes, I think so.
Okay, great, because I want to make sure that all of the options to you as far as treatment is concerned are crystal clear.
Yeah, that part is clear. I'm just not sure what this means for me, you know? What pros and cons are important for me, personally.
All right, so with the decision aid, we can go through all of that. We can find out what's important for you, okay? So here we can find some other reasons that patients in a similar situation are also saying about this.
Okay.
Okay? So now, on a scale of 0 to 5, 0 being not important at all and 5 being very important, how important is it to you to be able to visit the hospital less often?
Oh, that's pretty important. I'd give that a 4.
Okay? And secondly, how important is it to you to have control over your daily activities and the timing of your dialysis?
Well, that's really important. I like to do things when I want to, you know, where it's comfortable in my home and, well, it's a little private, you know? So I'd give that a 5.
Okay. And now, travel. How important is it to you to be able to travel for vacation or work?
Well, I don't travel very much, but it'd be nice to know I could. I mean, if something came up. I'd give that a 3. Actually, if I took peritoneal dialysis, would I be able to travel?
If we planned ahead, sure. We could ship the PD supplies to your destination, and all you do is bring the cycler.
Oh, that's good.
All right. Next, how important is it to you to avoid needles?
Oh, I think that's pretty important. I'd give that a 3.
Okay. Next, how important is it to you to have fewer dietary and fluid restrictions?
Oh, that's really important. I would love to be able to eat strawberries again. Oh, yeah, a 5 for that.
Okay. So those are some of the reasons why people choose peritoneal dialysis at home.
Okay.
Okay. Are there other reasons you'd like to consider?
Well, I heard it's a gentler treatment. Is it as effective?
Both treatments are about equal for what they do with filtering water and waste.
Okay.
But with peritoneal dialysis, though, people do tend to keep their kidney functions longer than with hemodialysis. Is this something that's important to you?
Yeah.
Well, what number would you give that?
A 4. I'd give that a 4.
Great. So now we've covered some reasons why people choose peritoneal dialysis. Now let's look at the options for you in a dialysis center. How important is it to you to have nurses take care of most of your dialysis treatment?
I'm pretty good at managing things for myself. I guess I haven't really thought about it, and I don't know what to do. But I guess they teach me, right?
Oh, yes, they would teach you, and they would also teach you how to manage things on your own as well.
Okay, good. Then that would be a 3.
Okay, now let's look at the social side of things. How important is it for you to have contact with other patients who are also receiving dialysis treatments?
Well, I guess talking to people in the same boat could be a benefit. I remember when my mom used to go with my dad for dialysis, she would talk to every single person. You know, I don't think it's so important for me. I guess I'll give it a 3.
Very well. Okay, now, how important is it to you to not have any equipment in your home or in your bedroom?
Oh, that doesn't matter to me. Give it a 0.
Okay.
Yeah.
And how important is it to you to be able to swim in a lake?
Oh, that would be nice. My son has a cottage, and sometimes we go up. It'd be nice to go for a swim in the lake.
Okay.
I'd give that a 3.
Okay. Now we've gone over some of the reasons why people choose to have dialysis in a dialysis unit. Are there any other factors you'd like to consider?
If I ran into problems, I'd have to wait to get help. But if I were like in an in-center, then help would be right there.
Well, we would actually teach you how to troubleshoot and how to pinpoint things that would make you want to call us right away. Right? Okay. So always know that if you run into any kind of challenges, the whole team is here for you.
Okay. When I think about it, I guess my dad didn't really have any trouble when he switched from hemodialysis to peritoneal dialysis, so I guess that's okay. I could manage. Yeah. Let's rate that a 2. 2.
Okay. Now you've looked at the reasons for each of the different types of treatment. Now, if we look at your scores, do you think that you lean towards one type of treatment more than another?
Well, it looks like I'm really leaning towards peritoneal dialysis. Wow. And talking about it, makes it feel like that's the right thing for me.
Okay.
Yeah.
So now let's check that section where you've got the highest numbers. Now the next step to consider is, do you have anybody else in your family that you'd like to consider in the decision-making process? Can you think of anybody right now who might be implicated or who might have a say in your decision?
Well, there's my daughter, Ashley. She's very supportive.
Do you know which option she thinks would be better for you?
We haven't really talked about it, but I do know she wants to go to England to visit relatives, so if travel's not an issue, like you said, you can make arrangements, so that's not a showstopper, so that would be great. Anyway, she wouldn't have to drive me to my appointments when it's snowing.
Would you like to offer your daughter a chance to be more involved in the decision making? Sometimes people find it helpful to bring the decision aid home to talk about it with their family and to get their input.
Yeah, that's a good idea. I'll do that.
So now let's just review everything we've talked about. After doing this, do you feel you know enough about the different dialysis options and the reasons to choose one over another?
Yes. I feel much better now.
Are you clear about which reasons are most important to you?
Yes? Yes, I am.
Do you think you've gotten enough support and advice?
Yes. Thank you. But I will show this to my daughter, and I'll talk to her about it.
Of course. And finally, are you feeling more certain about which option fits your lifestyle the most?
Yes. Yeah, it's a lot clearer now.
Okay, so now let's talk about the next step. How about I take an appointment for you to meet our access team so you can get more info on how to insert the catheter in your abdomen?
Yes, that would be fine. Thank you.
How do you feel now? Are there more questions that you'd like to have answered?
No, thank you. I'm actually feeling much better. I guess I'll see you at my next appointment.
Yes, you will.
Okay.
And in the meantime, if you have any questions, if you just want to talk, we're there for you. I'll give you my card. A card with our number.
Okay.
We're there for you.
Thank you.
You're welcome.
In the past, throughout the years, we've provided information to our patients and families over and over, individually or in group, to try to assist our patients in making quality decisions about their future care, either choosing transplant or dialysis at home or in a hospital setting when the time comes that their kidneys fail. We found that there was a gap. There was missing a part where we could assist the patients better in making their decisions. So we retweaked our information, but that was not enough. We then decided to come up with a tool that would help to assist the patient in really reflecting on what are their needs, what is important for them, what is the most important thing for them, where they can maintain their quality of life, and then make the best quality decision for their future. Since we started using the tool and then having a formal individual visit with the patient and their family, we found that the patients are much more confident in their decision. Some patients come and have made a decision already, and then it just reinforces the decision. Some patients come with maybe misconceptions about what they thought they would decide or what they thought they needed, but then talking to them and assessing their situation, at the end, they may change their mind and have a new decision and feel more happy about that new decision that will fit more their lifestyle. So in general, it's been a very positive experience, both for the patients but also for the staff. It's been very gratifying for us to see that the patients are more at ease with their decisions and better prepared for renal replacement therapy in the future. And the patients have over and over said that it's been a positive experience. They've included their family. They've had discussions that they may not have had individually with their family, but we've prompted them. And in the end, they've made the best quality decision with our assistance.
The nurse that went through the decision aid with me was very kind, very gentle, very caring, and I felt that she was listening to me. I felt that she could feel my pain, and she was answering questions professionally, but also from the heart, she was able to bring me to the point where I knew, without a doubt, that this was the dialysis treatment option that would best fit into my lifestyle. I actually left that meeting on a high. I was thrilled to know that as we went through this well-defined process, step by step, we didn't leave any stone unturned. I asked my questions, I got my answers, and my decision was clinched. I thought, this is the right thing. I believe that if the patient approaches this with an open mind and an open heart, that yes, this tool should work. It's a process that's well defined. It covers all of the steps, and as I say in my own case, I have no doubt that I have made the right decision.